Good morning everyone. Today we'll explore the key characteristics of implementation research, or IR, in the context of global health and artificial intelligence. Implementation research plays a crucial role in translating effective interventions into practice, bridging the often wide gap between evidence and real-world healthcare delivery. Throughout this session, we'll discuss what defines IR, its essential characteristics, methodologies, and its practical implications. From this lecture we will learn about IR's unique features, how it is demand-driven, context-sensitive, multidisciplinary and introduces frameworks like stakeholder and institutional analysis. How it must strike a critical balance between scientific rigor within real-world contexts. Together it builds a methodological lens through which all later topics are examined. Now that we know a bit about AI in global health research, GHR, it is important to understand its relevance and distinction between AI in implementation research. While AI in global health research or GHR may utilize AI for enhancing discovery and knowledge generation, AI in implementation research directly accelerates impact and intervention success. If you are ever confused, please return to this slide to distinguish between the two types AI uses. Let's start with understanding implementation research clearly. IR is the systematic study of how evidence-based health interventions are successfully integrated into real-world settings. Unlike traditional research, which primarily focuses on whether interventions work under controlled conditions, IR emphasizes the question, how can these interventions work effectively in everyday practice? It's both rigorous and practical, balancing scientific rigor with real-world relevance. A fundamental characteristic of IR is its demand-driven approach. IR research questions aren't driven merely by academic curiosity but arise from real-world challenges identified by stakeholders within health systems, such as healthcare providers, policymakers, and community members. This stakeholder-centered approach ensures IR remains relevant and actionable, directly addressing the practical needs and constraints of healthcare delivery. The collaborative nature of IR means that stakeholders are engaged throughout the research process, from identifying research questions to interpreting and applying findings, creating a continuous feedback loop that enhances relevance and uptake. Implementation research is inherently multidisciplinary. It brings together diverse experts, including clinical scientists, epidemiologists, biostatisticians, social scientists, and systems engineers. Each discipline contributes unique insights. Clinical experts understand frontline challenges, epidemiologists offer rigorous evaluation methods, social scientists provide insights into human behavior and culture, and systems engineers identify structural and procedural efficiencies. This collaboration allows for comprehensive, holistic solutions to complex healthcare challenges. Another crucial aspect of IR is its contextual relevance. IR acknowledges that interventions must be adapted to local contexts to be effective. While generating broadly applicable knowledge is valuable, interventions must also align with local conditions, physical environments, cultural practices, socio-economic realities, and health system capacities. This adaptability ensures interventions are not only evidence-based but also practical, culturally acceptable, and sustainable within their intended settings. IR operates within the perspective of health systems as complex adaptive systems, CAS. These systems are dynamic, adaptive, and characterized by nonlinear interactions among numerous elements, such as providers, patients, policymakers, and community structures. Because of this complexity, interventions might lead to unexpected outcomes, necessitating a flexible, iterative approach rather than a rigid, linear plan. Embracing complexity allows researchers to better anticipate and manage real-world implementation challenges. Implementation research follows a cyclical, iterative process. It begins by identifying implementation problems alongside stakeholders, crafting detailed research proposals, and then executing plans with ongoing monitoring and adaptation. This cycle includes analyzing qualitative and quantitative data, disseminating findings in accessible formats, and continuously evaluating impacts to refine approaches. The cyclical nature ensures interventions remain effective even as contexts and challenges evolve. The steps of this cycle will be explored further in Lecture 5. Implementation outcomes are influenced by multiple interacting domains. These include the intervention itself, which are the core components and modifiable elements. The outer setting, which contains the broader economic, political, and social contexts. The inner setting, which includes organizational factors such as culture, structure, and readiness. The individuals involved and their knowledge, attitudes, and capacity for implementation. Finally, the implementation process, which includes the strategies and methods used to promote adoption. Effective IR requires understanding these interactions thoroughly. These interactions will also be revisited in Lecture 5. Even proven interventions must navigate complex health systems to achieve real-world impact. IR studies how various factors, like accessibility, provider compliance, and patient adherence, affect the effectiveness of interventions. Identifying these critical points of failure allows researchers to develop targeted strategies that significantly enhance real-world outcomes. A critical step in IR is stakeholder analysis. This systematic process identifies key stakeholders, such as policymakers, healthcare providers, patients, funding agencies, and researchers, and assesses how they influence or are affected by implementation outcomes. Effective stakeholder analysis ensures all relevant voices contribute meaningfully to implementation planning and execution. Institutional analysis, which often uses tools like SWOT, which stands for Strengths, Weaknesses, Opportunities and Threats, helps identify internal and external factors affecting implementation success. Understanding these factors enables researchers to strategically leverage institutional strengths, overcome weaknesses, seize opportunities, and mitigate potential threats. This systematic study of organizational behavior helps researchers understand the institutional context in which implementation occurs, identifying internal capabilities and limitations as well as external factors that may influence implementation outcomes. An essential component in IR is clearly mapping the intervention logic, defining the actions, or activities, direct results, or outputs, changes achieved, or outcomes, and ultimate objectives, or goals. This model helps researchers identify assumptions at each step and monitor whether implementation is progressing as intended. By mapping the intervention logic, researchers can better track changes in implementation, identify where breakdowns occur, and make necessary adaptations to improve effectiveness. A logic model matrix clearly outlines objectively verifiable indicators, means of verification, and critical assumptions at each stage, goal, outcomes, outputs, and activities. This structured approach helps researchers systematically track progress, verify successes, critical assumptions, and understand barriers clearly. Assumptions are particularly important in implementation research as they highlight conditions outside the control of the implementation team that could affect success. Identifying and testing these assumptions helps assess the possibilities for replicating, scaling up, or relocating the intervention to other contexts. Implementation often involves feedback loops, positive loops that accelerate change, such as early successes increasing stakeholder buy-in, and negative loops that moderate change, such as resource constraints. Understanding these loops allows researchers to strategically manage implementation, maximizing positive dynamics and minimizing unintended consequences. Complex adaptive systems display unexpected behaviors, including feedback loops where the output of a process is fed back as an input into the same system. Implementation researchers must identify and understand these feedback mechanisms to effectively manage implementation processes and outcomes. A key challenge in IR is balancing fidelity, staying true to the proven intervention, and adaptation, modifying elements to fit local contexts. Identifying core intervention components versus adaptable elements helps maintain effectiveness without sacrificing local applicability. This creates a challenging balance. Rigid control to ensure fidelity may reduce effectiveness due to contextual factors, while excessive adaptation may compromise the core elements that make the intervention work. Implementation researchers must identify which elements of an intervention are essential and which can be modified without undermining objectives. They must also develop monitoring systems to track implementation changes and assess their impact on outcomes. Consider this real-world case. Imagine being a pregnant woman newly diagnosed with HIV. Fear of disclosure, stigma, and confusion about how HIV is passed to a baby, through the placenta, during birth, or through breastfeeding, often keep mothers from seeking care. PMTCT refers to the prevention of mother-to-child HIV transmission. In South Africa, researchers used an implementation research approach to improve PMTCT coverage. They first engaged local health workers and community members to identify bottlenecks, things like delayed antiretroviral therapy or ART initiation and unclear roles in clinics. Next, they co-developed interventions, such as training staff, introducing monitoring dashboards, and improving counseling around disclosure and treatment. Over 12 months, this participatory process led to major improvements. More women started ART during pregnancy, more infants received prophylaxis at 6 weeks, and there were overall declines in mother-to-child transmission rates. This case shows how addressing both client factors such as fear or lack of information and system factors which include staffing capacity, data use, and coordination of healthcare resources, can turn effective strategies like ART into wider, real-world coverage, a clear example of implementation research in action. Cultural sensitivity significantly impacts implementation success. IR must respect local cultural norms and adapt strategies accordingly, as demonstrated in studies like the acceptance of face masks in Somali communities or reproductive health research in Sudan. These cases highlight how cultural contexts significantly impact implementation success. Researchers must understand and respect local cultural norms, adapt research approaches accordingly, and consider potential unintended consequences of interventions that conflict with cultural values. IR is especially critical in resource-limited settings, which carry a high burden of global disease but receive minimal research investment. Building IR capacity, individually, organizationally, and systemically, is essential for meaningful progress. Academic public health curricula typically don't focus on implementation research, leaving researchers, practitioners, and decision-makers inadequately prepared for the interdisciplinary approaches required. Building local IR capacity in resource-limited settings is therefore a critical priority for improving global health outcomes. Building implementation research capacity requires a multi-level approach that addresses individual skills, team collaboration, organizational support, and system-level enablers. This capacity building is particularly important in low- and middle-income countries where the greatest need for expanding IR capacity exists. Effective capacity building includes training in IR methodologies, mentorship programs, institutional strengthening, and development of supportive policies and funding mechanisms. Throughout the capacity building process, feedback loops for monitoring, adaptation, and improvements are essential, as are strategies for integrated knowledge translation and uptake of results. Finally, measuring implementation outcomes, such as acceptability, adoption, feasibility, fidelity, and sustainability, is essential. Key implementation outcomes include acceptability and satisfaction with various aspects of the innovation, adoption by measuring intention to try or actual use, appropriateness or perceived fit and relevance, feasibility or extent to which an innovation can be successfully used, fidelity or degree to which an intervention was implemented as prescribed, implementation cost, penetration or well the innovation integrates within a setting, and lastly sustainability or extent to which an innovation is maintained. The future of IR includes leveraging AI and participatory methodologies, refining strategies, and deepening the understanding of complex health systems. Particularly mobile health technologies are expanding possibilities for real-time monitoring and adaptation of implementation strategies, particularly in remote or resource-limited settings. You will hear all about this through Dr. Tyrell and Dr. JC's work in Costa Rica. In summary, implementation research bridges the gap between evidence and practice through systematic, multidisciplinary, context-sensitive, and ethically responsible approaches. Understanding these characteristics equips us to tackle global health challenges effectively. Thank you.